So welcome Kathy Crossing, you are the chair of the Gawler Health Advisory Council, situated at the Gawler Health Service, which is our Gawler Hospital. Welcome.
Thank you.
We're talking all things health today, and it's a bit of a passion of mine, but I know you're passionate about it as well. So firstly, tell us a little bit about what the role of the chair does for the Gawler Health Advisory Council.
Yes, absolutely. Thank you. Thank you for the invitation to come and talk. The Gawler Health Advisory Council was set up under the Healthcare Act. We are made up of a range of members. A number of them are community members, so people, each year we have our annual general meeting and people can nominate to be on the Health Advisory Council for a term or a year, or we have some people who rotate over regularly and some people who have been there with a very long time, with a very long history of Gawler. We also have representatives of council, we have representatives of state government and staff from the Gawler Health Service. So the purpose of the Health Advisory Council is really to be that conduit between the community's views and queries and understandings of health and the Gawler Health Service. Yeah. So we have quite a strong community engagement role, a level of advocacy when needed, some work around health literacy where we try to help people might be hearing things in the community and wondering what does that actually mean in the health service, and then we can help to translate that.
Yeah. So it's quite an important role for the community to get involved, to have a real say in how our health gets rolled out, and advise SA Health, who runs the hospital, or our local health network.
Yes.
And it really is an important role, isn't it?
Mm. Yes, and I think it's that, health is an enormous beast organisation, and for even those who work in it, it's sometimes really hard to navigate or to understand, and by no means are the HAC members ever putting ourselves up as being experts in that space. No. But we probably have an increased access to health professionals to say the community's not understanding this. Can you please explain it?
So we're a growth area, as we all know. What type of activities is the council doing, but also in collaboration with the health service, in regard to growth?
There's a range of things. So ongoing, we try to do a level of community consultation. So through some of that consultation, we've had conversations around the areas and the challenges that the community are facing in terms of accessing healthcare. Then there has been community clinical services planning. So that's where the Gawler Health Service, and that's happened across the whole Barossa Hills Fleurieu region. They've looked at what are the clinical services and the demands for clinical services, and clinical services could be anything from inpatient beds to diabetes nurse in the community, community health, Aboriginal health, any of those components to go. What are the trends in the usage of services that we're seeing, or the pressures for gaps? And then, so that's about, if you like, people and services, and then to deliver those services you need bricks and mortar or digital solutions. And so then the next process that Barossa Hills Fleurieu and a lot of SA Health is undertaking is a master planning process, and that will happen in the future for the Gawler Health Service.
So that's pretty exciting, isn't it, to do a master planning process, and I know people will be excited about that. They'll want to feedback. So when the process starts, how do you engage with the community?
So one of the challenges around that is that because it's largely a bricks and mortar, there is an information process for the community, which we are already having those conversations, so people need to know about it. I think there will be a much bigger role for stakeholders, such as the council or the local GPs or Commonwealth, because it's about a 10 to 15 year plan. And while some of a master planning process is what buildings do you need, so So, for example, I don't know where we're going in Gawler yet, but if you look at the Mount Barker have just done their master planning process and now committed to building a new hospital. They've gone from 36 beds to 106 beds. So thinking about the population growth in Gawler, we do need to be thinking big picture about where we might be going, but that it can't all be about delivering healthcare in a hospital, because that's one of the most expensive ways to deliver healthcare.
Yeah, it is.
And when we think about our population, we need to think about other ways in which they can access healthcare.
Yeah. So we have My Home Hospital, which is now here in Gawler, which I think is a really good service. And that could be potentially expanded to have different arms of specialties, nurse-led services overseen in collaboration with GPs or other specialists, depending on, and you can do that remotely, you can do that electronically or digitally. So it's actually quite exciting of how we could actually set up a seamless service so that people do get access. They don't feel they're not going to get access.
No, and I think there's some real communication we need to do with the community and the service providers about building confidence in that, because I think it's a very different way of delivering healthcare. But for a long time, we've been really accustomed to having our healthcare delivered a little bit like this, face to face with somebody that we can literally touch and feel. And I think there is some real anxiety. I think there has been some good uptake in the My Home Hospital, but I think there's a lot more capacity. But some of what we hear is a hesitation, both a little bit, I think, from the service providers in terms of the GPs going, where's the protection for them? I guess if the GP sees you in their practice and they can touch and feel you and do your blood pressure and lay their eyes on you, how do we ensure that they're protected by doing it virtually, that we can cover off on the same kind of things? And just on that point, I think that whole accessibility of healthcare, I think, is a massive conversation to have, because I think it's around a whole range of things. It's about the right healthcare at the right time, at the right place. It's about, as you were saying, our population being able to access it, and a broader issue, which you and I have touched on in other forums, has been the issue of transport. And that's a complex problem with not an easy solution. If there was an easy solution, we all would have done it. But I think it lends itself to the digital healthcare response, because it is difficult for a number of people in our community to actually get to specialist appointments or even into their GP because of time and appointments, and the difference between the time frame in which they need healthcare and can get their appointment. So if they could get some kind of assessment done in another way, because what we've seen, not just in Gawler, but Gawler is representative of what's happening in the rest of South Australia, is we've seen a significant uptick in the people turning up to the emergency department because they can't get into other levels of healthcare in a timely way. And so then the only alternative is after 5 o'clock in Gawler, there is no other healthcare other than the ED department, which does a really good job, but clearly waiting times are going to increase because the number of presentations are increasing.
I think that's very fair comments. I'd like to talk about Concordia now. Concordia has been announced. There's a big long process before houses get built, and that will take time. However, if we're looking at 10,000 homes, we're potentially looking at 30,000 people, just times it by 3. 3 people living in the house. Could be more, could be less, but if we look at 30,000, Gawler will go up to about 30,000, and so it'll double our population. It's 850 metres to the main street, Concordia, so it's really close. So people who live in Concordia will come here, they'll come to our hospital. How do you think, what challenges do you think arise as a result of that announcement?
I think that it probably adds to some of the challenges that we already have in Gawler, like it'll exacerbate them. and hopefully on the positive side create opportunity.
Yeah.
So right now in Gawler we have our main health service at one location, and while it's not that far from the main street, because it's up the hill, there are barriers to accessing it. We have the Concordia announcement, but we also have Springwood, and we have, very sorry, cannot remember the name of the one.
Roseworthy.
Thank you. You know,
Yeah, absolutely. And 2 Wells.
and I think
Yeah.
this is where
Yeah.
the future planning, if we're talking about bricks and mortar or accessible healthcare, we need to not just be thinking about one site for Gawler.
Yes,
We
yeah.
need to be thinking about whether, you know, clearly every town, and a town
Yeah.
of this size, is going to need a significant hospital with beds, but other kinds of healthcare don't necessarily need to be delivered on that site.
Yeah.
And we need to think about how they can be more accessible
Yeah.
in various locations in our community. And again, you know, this is the world according to me, not necessarily anybody else. But the way, you know, if master planning process is 10 to 15 years, if you look back 10 to 15 years, how much healthcare has changed, we can't necessarily predict what it looks like. So if we're going to build bricks and mortar, they have to be built in a really flexible way that will be able to shift with the changing health needs. We know we've got a really fastly ageing population.
Yes.
Without the workforce to support it.
Yes.
We've got the whole aged care review that is still happening.
Yeah.
We don't have enough aged care. You know, we need to be supporting our community to stay in the home.
Yes.
And that means we need to be thinking very much, I think, about how health outreaches into the home for the community, rather than, and digital, you know, all of those kind of mechanisms really need to come together to get a comprehensive plan for the future.
I think you're right. I think, you know, just building bigger and bigger hospitals, more and more beds, is a one-dimensional look at the future of healthcare. And you need to build centres, you know, comprehensive centres where people can go and have their healthcare, get access to healthcare without having to be banked up in an emergency department, because that's not a solution. It was never meant to be a solution, but because people can't get into their GP, that's clearly what people have to do. And I would probably do the same thing, and you would probably do the same thing, you know, because you want to get healthcare. So it really is quite inefficient to manage it that way, but I'm sure there's many people thinking long and hard about the long-term strategic plans and where we need extra healthcare. And I think council has a role too, local government has a role in providing essential services like walking tracks, you know, like trees, so that it's comfortable when you're walking and it's not, you're not in the blazing sunlight today when it's 41 degrees. Local government can work in collaboration with other levels of government and even health services. We have a regional health plan, which is, I think, quite an important document, and how we work together to ensure that we don't duplicate, but we complement. I think this has been a great conversation. Thank you, Kathy, for coming along.
Thank you.
I'm sure most people will really resonate with what we've been talking about and the challenges, and I think I really am thankful for you being the chair of the Health Advisory Council. I think you're a great pick. I know you're highly regarded, so I think thank you very much for coming along, and I think it's a really important conversation we're having.
Thank you very much for the opportunity.
No problem.